Arrhythmia is an abnormal beating of the heart. In atrial fibrillation, the top chambers of the heart beat chaotically. They can be asymptomatic patients, they can be patients with a very vague symptoms as fatigue, tiredness, loss of the same functional capacity, or a decreased quality of life. In atrial fibrillation, the top chambers of the heart, they're squirming, they're squiggling instead of making a rhythmic motion. And when it does that, blood can stagnate in the crevices or the small areas of the heart, and when it stagnates, can form small clots, just like when we get cut or we bleed. And if that clot, at some point of time when it's beating, travel to the brain or the hands or the legs or any parts of the body, they can have a stroke. The electrophysiology lab at Robert Wood Johnson University Hospital has a wide variety of modalities and technologies to treat atrial fibrillation. The remote magnetic navigation is definitively the state of the art. We make a live, three-dimensional picture of a patient's heart with a catheter inside the heart that measures and maps the different parts of the heart. And there are two large magnets on the side of the patients which control the magnetic tip on the electrode of the catheter that is sitting inside a patient's heart. Using remote magnetic navigation system is safer for the patients primarily because it reduces the risk of a manual catheter possibly causing a hole in the heart or excessive damage or force to the heart muscle. It reduces radiation exposure because you're using less X-ray to both the physician and the patient. We are the #1 in the country for the number of cases that we do. My passion really comes from my love for patients, and then it would come because I have also a great passion for electrophysiology and cardiology.